We have to put all those factors into account if we're devising a diet for a person who's diabetic and we want to get optimal results. And we have to, at the same time, promise them with 100% certainty, and this is the most important thing, that if you follow this, I can guarantee you you won't need those diabetic medications. We can cut your diabetic medications down right away. We'll have you become, we won't be controlling your diabetes. If you're a type 2, we'll be having you become undiabetic. And you'll get dramatic results that'll add many years to your life and prevent you from developing blindness, leg amputations, kidney failures, and all these horrendous tragedies that befall people with diabetes. And it could be tremendously motivating. I remember once I had a patient who was sent to me by an endocrinologist. His blood sugar was 400 to 500, and he was on about 300 units of insulin a day. I said, what? Plus oral medications too. This guy got off his insulin completely in the first month. The huge guy. Already had his toes cut off, by the way. The doctor that sent him to me wasn't the diabetologist or endocrinologist. They never send me their patients, because they know the minute they do, they lose the patient. The diabetologist sends him to the nephrologist. The nephrologist, when their kidney function starts going bad, the diabetologist refers them to the nephrologist, and the nephrologist refers them to me. They always come in that back door, never from the diabetologist directly. And of course, the guy's kidney function get better. I remember one story where this lady, her name was Janet, she was a school principal. She went into the emergency room with a complication of her diabetes. She was a lovely lady, and the emergency room doctor liked her so much that he whispered in her ear, "Don't tell anybody, but go see Dr. Fuhrman. But don't tell anybody I told you that." So this lady comes in to see me, and to make a long story short, she gets better from her diabetes, and she writes this beautiful article that gets published in a publication for school principals, because she was a school principal. And the American Diabetic Association, someone working for them, picks up this article, and they call me on the phone, and they say, "Can you write an article for our national magazine that goes out to all diabetic teachers and people with diabetes?" And I say, "Sure." And they send me a check for $750. And I said, "Write it for nothing, but you pay me a check for $750? Great." I cash the check, I write the article, I send it in, and they call me back on the phone and say, "Dr. Fuhrman, we can't print your article as it's written, because you have an example of 4 patients, all who came off their diabetic medications. And our magazine is sponsored by Eli Lilly, who makes insulin. So can you tone it down so the patients are improving but not coming off the medications?" And I said, "No, I can't." I said, so I sent them their check. But a very nice person on the phone. She admitted to me what the problem was, and she tried to work with it, but I, didn't want to change it, so I guess I didn't.